Hey, good morning. I'm Vic Senese with UroNurse News. Be sure to like and subscribe. Today, we're discussing an important new study looking at a unique prostate cancer situation called incidental prostate cancer. Cancer that's discovered unexpectedly during a procedure performed for another reason. For many men, this diagnosis raises important questions. Does finding prostate cancer by accident change survival? How many years of life could potentially be lost? And which patients may benefit from treatment versus just observation? A large interventional research team analyzed data from over 7,000 men to answer these questions. Key message: not all incidental prostate cancers behave the same. The risk level matters, so let's take a closer look. Incidental prostate cancer, often called IPCA, occurs when prostate cancer is discovered unexpectedly. For example, a man may undergo surgery for an enlarged prostate known as BPH, and the tissue removed during that procedure shows cancer cells. Unlike many prostate cancer diagnoses, these men may not have had a cancer workup leading to the discovery. The researchers wanted to understand an important question. Does incidental prostate cancer shorten a person's lifespan compared to men without prostate cancer? To answer this, investigators used data from the SEER database, which tracks cancer outcomes across the United States. The study included men between the ages of 45 and 75 years old, diagnosed between 2004 and 2021. Researchers then compared survival outcomes using advanced statistical modeling, including simulated life expectancy comparisons. Essentially, they asked, compared with the average man of the same age, how many years of life might be lost after an incidental prostate cancer diagnosis? Good question. The study included 7,324 men with incidental prostate cancer. About 26.7% received active treatment, such as radical prostatectomy or radiation therapy. 73.7% did not receive active treatment. When compared with men without prostate cancer, incidental prostate cancer patients experienced an average survival disadvantage of 0.23 years of life lost. Let that sink in. That equals approximately 3 months. However, the researchers found that the risk was not evenly distributed. Men who did not receive active treatment had a larger survival disadvantage, 0.25 years lost compared with 0.18 years among those who received treatment. But the most important finding came when researchers looked at cancer aggressiveness. Men with higher grade cancers, especially those Gleason 8 through 10, had significantly greater risk. For men with Gleason 8 to 10 cancer who did not receive treatment, the survival disadvantage increased to 2.67 years lost. And when combined with stage T1B disease, the disadvantage reached 3.02 years lost. Now, one of the most important messages from this study is that risk stratification matters. Not every incidental prostate cancer requires immediate aggressive treatment. For men with lower risk disease, including Gleason score 7 or lower, small volume disease, favorable clinical stage, the researchers found that avoiding active treatment did not appear to increase premature death. This supports the concept of personalized prostate cancer care. Some men may be more appropriate candidates for active surveillance, monitoring the cancer closely with PSA testing, imaging, and repeating evaluations. Others, particularly those with high Gleason scores, more advanced clinical stage, higher risk features, may benefit from active treatment. Now, the decision should not be based only on the fact that cancer was found. That's the key here. It should be based on the cancer grade, the stage, patient's age, and their overall health. And, ask the patient what they prefer. Their input's important. It's their body, right? So what should patients take away from this research? First, an incidental prostate cancer diagnosis does not automatically mean a poor outcome. Second, low risk incidental prostate cancer may often be safely monitored. And third, I like this 3. Third, higher risk cancers, especially those with aggressive Gleason scores, may require treatment to reduce the chance of premature death. If you or someone you know has been diagnosed with prostate cancer unexpectedly, the next step is detailed conversation with your urologist. You want to talk about your Gleason score, your cancer stage, your treatment options, and whether active surveillance or treatment is your best approach. Thank you for joining me for this edition of UroNurse News. I'm Vic Senese, bringing you the latest information in urology, prostate health, and men's health. If you found this helpful, please subscribe to the UroNurse News and share this video with someone who may benefit. Tomorrow on UroNurse News, I take a closer look at HoLEP surgery complications. Yeah, that's right, holmium laser enucleation of the prostate. It's become a leading treatment option for men with enlarged prostate. But what happens when the patient develops a urethral stricture after surgery? Want to find out? You better tune in tomorrow. We'll see everybody then.
The experts' opinions in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.